Hi there, my name is Malavika Rahul, and today I'll be presenting on the global disparities in access to pediatric autism care. To introduce myself, I'm a rising senior at Westview High School in Portland, Oregon. Some of my interests include computational biology as well as oncology. Some of the activities I partake in include HOSA, NHS, varsity tennis, as well as research in neuroprosthetics and brain tumors. And in the future, I aspire to become an oncologist. To introduce the topic of autism spectrum disorder, according to the National Institute of Mental Health, ASD is defined as a neurological and developmental disorder that affects how people interact with others, communicate, learn, and behave. These challenges are not limited to childhood, but persist throughout an individual's life, causing difficulties at many key stages of development. Recent efforts to quantify the scope of autism globally were advanced on February 10, 2025, with the publication of a comprehensive study titled The Global Prevalence of Autism Spectrum Disorder in Children. Here, researchers reviewed 66 studies from 2008 to 2024 involving over 21 million children aged 3 to 18 using standardized diagnostic tools. They conducted a systemic review and meta-analysis following the PRISMA Preferred Reporting Items for Systemic Reviews and Meta-Analysis and Cochrane guidelines. Conclusively, they determined that globally nearly 0.77% of children are diagnosed with ASD. Building on these findings, it's clear that autism is a worldwide condition, though its prevalence differs significantly from one region to another. From the previously mentioned study in high-income countries, autism affects about 0.86% of the child population, compared to just 0.54% in low and middle-income countries. This gap likely reflects differences such as diagnostic practices, not actual prevalence. Higher rates in wealthier nations stem from better detection and broader definitions, while underdiagnosis and limited research contribute to lower reported rates elsewhere. For instance, only 3 studies have focused on low income countries, making global estimates less reliable. But these unreliable rates alone don't capture the stark inequalities. Children in some countries have access to robust services, while others face significant struggle to receive care. The US, Canada, UK, Germany, Australia, and Sweden are some countries with the most effective treatment options. These options include ABA, or Applied Behavior Analysis, which is a specialized therapy that focuses on evaluating a child's emotional, physical, and behavioral symptoms and accordingly personalizing their treatment. Ultimately, this therapy aims to assist children in regulating their emotions and behaving appropriately given the social context. Speech and language therapy addresses language difficulties and challenges with social interaction, helping children use and understand spoken language, body language, and other forms of communication. Occupational therapy targets and seeks to enhance the development of daily living skills to ultimately help children become more independent at home and school settings, allowing for better social integration. Early intervention comprises of services and support provided to children typically less than 3 years of age when autism is suspected in order to develop communication, social, and thinking skills as early as possible for the best long-term outcomes. Cognitive behavior therapy, or CBT, is another form of therapy that identifies unhelpful or negative thought patterns and provides strategies that assist in coping with these challenges. CBT aims to alleviate stress and anxiety that children with autism may have. But in many low and middle income countries, or LMICs, families of children with autism face a daily struggle to find adequate and meaningful support. Effective services that are common in wealthier nations are often unavailable or unaffordable. In rural India, for instance, families may have to travel hours just to reach a basic clinic if one exists at all. First-handedly, I've seen this struggle. My cousin who lived in India had level 3 autism. She lacked the adequate care and resources needed for her differing conditions, such as speech therapy and occupational therapy, making it difficult for her to execute even the simplest of functions. Further, according to Roy McConkey, a professor of developmental disabilities at the University of Ulster in the UK, in Kenya, while organizations like the Autism Society of Kenya offer important services in cities, families in remote areas are largely left on their own. The lack of resources is not only financial, it's also important to note that there are not enough professionals, and community health workers often lack the specific training in autism. McConkey also suggests that LMICs must utilize more broad-based support and treatment systems, as opposed to the currently highly specialized services that can leave many unsupported. He additionally states that the current systems must emphasize function-based needs, rather than making specific diagnoses. Given these inequalities, it's very clear that LMICs must prioritize building community-based autism services that can reach all children. This includes training local health workers in autism-specific skills and integrating autism support into broader child development and health programs. Further, government should focus on allocating funding while also partnering with NGOs, parent groups, and international allies to invest in vital resources needed for the most effective treatment options. Lastly, global collaboration is very much needed. There must be a collaborative focus on sharing practical tools, resources, and knowledge that LMICs can put into action right away. These collective actions can significantly reduce the equity gap and ensure that more children receive the support that they deserve. Thank you so much for listening to this presentation. Here are the resources I used, and I'd like to thank the Global Health Leaders Conference for this amazing opportunity. Here is all my contact information, and thank you once again for listening to this presentation.